Welcome to Medical Billing Advocates of America, presentation on reducing healthcare costs. Healthcare fraud is a problem that affects every payer throughout our country. The Patient Protection and Affordable Care Act cannot begin to reform our healthcare system without the implementation of investigations and prosecutions to eliminate the abusive billing practices and price gouging that has become second nature in our healthcare system. MBAA advocates have taken the approach to implement changes through their advocacy work on behalf of all healthcare payers. Our services can help consumers to reducing medical expenses, and perhaps they would not have to make a choice between medical care and putting food on their table. Self-insured groups to lower overall medical expenses for their company as well as their employees. Insurance companies to reduce premiums and allow more consumers to have health care coverage. Providers to obtain true insurance reimbursement for services rendered. And attorneys with documentation to settle cases without the costly expense to our court systems. Consumers are the least knowledgeable about our complex billing system and are forced to rely on the medical industry for accurate billing. Neither the insurance company nor the healthcare industry is looking out for your interests. NBAA's expert consumer advocates are dedicated to helping consumers reduce medical costs. Our consumer advocates will sort through the mounds of paperwork from your medical providers and insurance companies, order the necessary medical and insurance statements, and analyze the accuracy of your medical charges and insurance payments. America's leading business executives indicate that healthcare costs rank as a top issue that impacts businesses' profitability. Yet most CEOs and CFOs could not tell you how their healthcare dollars are being spent. They rely on claims processors to lower their healthcare costs rather than an auditing firm. Our advocate services for self-insured clients include determining if providers have billed in accordance with state and federal guidelines and regulations. Equally important is the TPA's adjudication of claims in accordance with the specific plan developed by the self-insured group. Our comprehensive payout review service results in a detailed report of findings, including the scope of the errors we find, a description of the advantages to be gained as a result of our findings, and the ramifications of the errors from a financial perspective. Thousands, if not millions of dollars are being wasted in our healthcare system due to the fast turnaround time being upheld for insurance claims processing. This discourages insurance companies from analyzing any high-dollar billings from facilities. A traditional medical record audit is time-consuming and often performed on-site at the facility. Our advocates have overcome the barriers by performing compliance audits prior to payment. Our compliance audits identify routine items that are considered to be the cost of doing business and are not billable, duplicate charges that are factored into the cost of another charge, incorrect use of CPT and HCPCS codes. Industry average shows 30% of all medical claims submitted to insurance companies are returned or unpaid due to errors resulting in a substantial loss of revenue. A patient collection agency is not the answer. NBAA advocates can be the step before a patient collection agency. Our services help to increase revenue, improve billing efficiency, decrease aging accounts, decrease AR write-offs, and enhance your relationship with patients. Medical Billing Advocates of America is encouraged that more and more attorneys will be accepting cases involving medical billing disputes with the evidence that MBAA advocates can provide for successful settlements. If your case involves medical or hospital bills, our specialized advocates can significantly reduce the total charges by identifying erroneous, fraudulent, and abusive billing practices. Our advocates address three distinct areas. Are the charges that appear on the itemized statement associated with the patient's medical care and corroborated by the medical record documentation? Are the charges billed in conformance with billing regulations that govern inpatient and outpatient billing compliance that are applicable to all payers? Do the charges billed meet the definition of fair and reasonable price for services rendered? Let our advocates be a part of your healthcare team and show you the way to reduce healthcare costs. Medical Billing Advocates of America, along with its nationwide network of advocates, will make every effort to assure true and accurate billing for healthcare services in America.